So let's kick things off because today what I wanted to touch on were three-ish different topics. One of them being what's going on with measles. We're seeing cases soar, and we're also seeing the impact that it's having on detention centers around the nation. Then we're going to talk about the Moderna mRNA flu shot, sort of this whiplash effect that we've experienced. And we'll get into what I'm talking about there in a moment. And then we're going to end with something fun because RFK Jr. and Kid Rock are really teaming up to encourage people to stop with processed foods and work out inside saunas for whatever reason. So we're going to end with a little humor because we all need it. But let's first start with a conversation around what is going on with measles in particular. I mean, Dr. G, you and I talk a lot about preventative health on these segments. We talk a lot about different viruses that are upending people's lives and livelihoods. But this is very concerning to me, to you, to a lot of people out there, because measles was something that I felt, that I think a lot of us felt was sort of in control. We had control of it. But the United States is facing a significant measles resurgence with 588 confirmed cases so far just this year alone, which is a massive amount, marking an accelerated outbreak driven in large part by a major cluster in South Carolina, where 58 new infections were reported in just 3 days. This surge is really underscoring how quickly measles, one of the most contagious viruses known, can spread in communities with declining vaccination coverage, which threatens, of course, public health gains over decades. This outbreak was also driven largely by the declining vaccination rates and concentrated in multiple states with low MMR coverage, and it has now spread across communities everywhere and threatens to reverse decades of public health progress in controlling a totally preventable, vaccine-preventable disease. Dr. G, let's talk a little bit about just the general fears and concerns you have as a physician, hearing how we're seeing an uptick in viruses that you may have never even seen in real life as a doctor when you were in med school. Can you touch on that a little bit?
Yeah, no, a lot of us in the medical community are trying to brush up on what this even looks like and what to expect, because we've not actually seen it in clinical practice. This was eradicated. So it's definitely a scary time. I think it's also a scary time. I was looking at this one article that we were kind of batting around before this, Natalie, and there's this quote talking about how this is not being really taken seriously. Like, we have people in leadership that are saying, first of all, this is just the cost of doing business. Sorry. People need this freedom of choice. And so people are going to die. People are going to be infected. Little babies are going to be hospitalized with encephalitis. Like, these things are going to happen, but that's the cost of doing business. That to me is terrifying, because that again reiterates this mentality of, we are individualistic. This is not our problem to take care of each other. And people are expendable. And if people are expendable, especially children and human lives are expendable, there is really nothing sacred anymore then at this point. So, as a citizen, that really scares me. As a human being who likes to travel, this really scares me, and as a physician, it's disturbing.
I'm really glad you brought that up, because I don't think we talk about what you just touched on enough. This idea of what is the point then of a society, right? When we think of a society, I think of public roads, I think of public schools, I think of hospitals, I think of grocery stores. I think of things where people come together to meet basic needs and support one another and be able to easily access touch points, right? So when we're talking about this individualism, this rugged individualism, I have to underscore, one, how dangerous it is to only be thinking of yourself and your nuclear family. Because as you know, Dr. G, none of that holds. Viruses don't care about state lines. They don't care about communities. Things travel in the air, right? So one. But the second part of that is, when we look at that, it's always about the individual being put at risk. And then when we zoom out, who always gets saved are the large corporations, right? The bailouts, the things that we see on a commercial level, on a capitalist level. But yet we, as the individual, as this person, are supposed to take all of this risk for the cost of doing business. The cost has become too high. And I think what concerns me the most is the propaganda machine of continuing to feed this narrative that we don't need one another when we absolutely do, not just out of that humanistic need, but for a society to function. And I think it's really weird to think that your individual rights supersede the collective ability to exist, right? So it's fascinating to me on a philosophical level, but on a very practical level as a physician, this just must be a very frustrating thing for you.
I find that the amount of confusion around public health measures that has been caused in just a year
Mm,
has been very challenging to keep up with as somebody who speaks a lot about public health on a regular basis, not just one on one with patients, but in media and on
oh,
social media. And it's very challenging when you have, first of all, a message coming from leadership in this country about unity and how United States are the best and we've got to have this unity in this country. And it's this like, okay, great, like, okay, let's protect this country. Then
mhm,
we have the other side of the mouth that's saying like, but it's this individualistic choice. Do your own research. It's your personal freedom. But then also we're going to take away your freedom to choose things around like maybe women's health and our bodily autonomy. But also, you should go and get this vaccine, Dr. Oz says, because the measles one actually is okay. But then CDC, like, I mean, it is really confusing here because there's no consistent through line that really helps us as the general population understand what the guidance is and why.
yeah.
And I think that we're giving the United States population a lot of credit here to think that they can piece this apart.
Mm.
I mean, maybe everybody else understands it, but I, as someone who does this day in and day out, sure can't follow this and I'm very confused. So I would imagine others are as well.
No, and I think that's a very fair point. The real virus, the worst virus of all, is that of disinformation and creating that sense of confusion as we're talking about our healthcare system. And it's only seeming to get worse. And I wanted to dovetail that a little bit in here in a moment, but just to so people understand, can you explain a little bit about measles and why it's so contagious? Because there seems to be this confusion too that how you contract the measles when once again, many of these things are airborne. And the reason it's almost like the vaccines were a victim of their own success because or casualty of their own success because it was like they almost work too well that people don't understand why they need them anymore.
Yeah, I liken it to when I have a patient who has severe depression and anxiety. We've done
Hmm.
everything possible from a lifestyle perspective. They end up going on a medication, and all of a sudden they've felt better. And it's
Yes.
years upon years they felt better. And they say, you know what, I'm feeling better. Maybe I should stop this medication. Right.
Hmm.
Because like they don't
Hmm.
remember what it was actually
Mm.
like. And in this instance with measles, we both don't remember. And
Yeah.
for a lot of us who are in my age range and my training level, never saw it in the first place. There's nothing to remember because it didn't exist. Right.
Right.
And so what people are now in the public saying, like, well, I've never seen measles. It's not been a problem. Why are we so worried about, protecting people from getting it? What?
Mhm,
You
mhm.
realize the reason why you haven't seen it
Yep.
is because we've gotten rid of it with a highly effective vaccination. And this is a highly contagious virus. And when
Yes.
you put people in close contact, like they are on an everyday basis, like they are, by the way, which I know we'll touch on in detention centers,
Mhm.
in airplanes, like all of this, what do you think is going to happen?
Exactly.
Exactly what is happening.
And you know what scares me too, Dr. G, is this idea that I sent you this article a couple of days ago because it made me so angry. Around this mother who didn't vaccinate her child. The child ended up with measles, is dealing with severe brain swelling. And the mother said, I still wouldn't vaccinate them. I don't understand mentally how we've gotten to this place where we've created such fear around a vaccination that we as a society are saying, I'd rather let my child suffer and potentially die, and I'd do it again. How do you as a physician deal with that? Is there any dealing with that? I mean, how do you talk to a potential patient that comes in and says, hey, I'm looking for a pediatrician, but I don't want to vaccinate my children? Not because they can't be, but because I
Yeah.
choose not to.
those situations, I just don't find them to be a good fit for my practice if they are dead set on never vaccinating, because frankly, it puts the other people in my practice at risk. It puts me at risk, my office staff, those people in the waiting room waiting to see me, let alone when they leave the doors of this office, right? But all I can control is my office setting. I have patients that choose to delay vaccinations or space them out. And I've found that those have been really rewarding relationships because in those instances, we've been able to talk through disinformation, allay some fears, help work through it. But frankly, in my practice model, you can come see me as much as you want. If I worked in a general system where my next available appointment is in 6 to 12 months, you can barely get in the first place, let alone come in for repeated delayed vaccination visits. That's not realistic. The strain that puts on the healthcare system is something that people I really don't think understand. And so it's, you get this bad rap as a doc who doesn't want to see patients who aren't going to vaccinate their children. But there is a lot more behind that than like, we just think that you aren't smart because you don't want to do this. That's honestly for most of us not the case. Like, I'm a mom. I'm not going to sit here and judge these decisions that people are making, because the amount of times I've second guessed the things I've done for my kids is innumerable. In the end, we do the best with the information we have in front of us. And unfortunately, there is a subset and growing subset of the population that thinks the information in front of them, telling them that their kids are going to have autism because of a vaccine, that's the information they have in front of them, and that's what they're taking as truth.
Yeah.
It's very challenging to go up against.
I get that. And that's why I really applaud you for taking the time when you do so much of this work on social media, and when you go on local news stations and try to debunk mythology, because I think we need to hear it directly from your family doctor, right? You're not this thing that exists in the ether that has no face or name. You're somebody in a community that can speak about their community as a family care physician. I think that's important. And as we wrap up this topic, I wanted to touch on this because you had mentioned this point, because this is extremely concerning as well. This week, a growing chorus of Democratic lawmakers, this is from CNN, is calling for an urgent reform in how the United States provides medical care to immigrants and, in some cases, United States citizens as well, detained by ICE. Reports and lawsuits allege prolonged delays in critical treatments, inadequate access to care, even for life-threatening conditions like cancer, a systemic neglect inside federal detention centers. Lawmakers are now linking oversight and funding for Homeland Security to substantial improvements in detainee healthcare and transparency. We've seen an outbreak of COVID. We've seen RSV running rampant. And now we're seeing the measles impacting our children, our babies, and adults. And I just want everybody to remember, Anne Frank, okay, she died of typhus inside a detention camp, inside a concentration camp in Germany. This, to me, I think is an important note to link, because as we're staring down the face of this reality that we have chosen to create by opening these hellholes, these detention camps, we are also having to then stare at our history and see the parallels. And so when I think of those children that are being exposed unnecessarily to viruses that could kill or disable them for the rest of their lives, I can't help but think of Anne Frank and what happened in Nazi Germany and how we are choosing to replay that narrative. Dr. Gentile, when you hear that information around what is going on in these settings, in these detention camps around healthcare, the lack of access, and this is becoming more and more documented, this is not hearsay or one-offs. How does that make you feel as a physician? And what do you want people to understand from a medical perspective of how dangerous situations like this are with sort of concentrated illnesses in a space?
So I'm going to say something that is going to sound like a conspiracy theory, but this is
welcome.
Science.
Yeah,
this is science. Get out your tinfoil hats. No, this is science. None of this is that surprising or like exceptional news. We already know what happens when you have people who are unwell with viral illnesses like COVID, RSV, measles, and they're sick, and then you put them in an enclosed space.
Yeah.
So let's start there. unless you have never like read a newspaper, looked at a textbook, looked at a scientific study, or woken up every day, and this is your first day on Earth, this is not surprising. So
Yeah.
when you're trying to get rid of people,
Mm-hmm.
which is what a detention center is, right? Like you're trying to eliminate them from the current place where they are, and then you put them in a tight and closed space and they're sick, what's going to end up happening is
Right.
exactly what's happening, and it should be surprising to nobody.
Mm-hmm.
Nobody. Okay.
Mm-hmm.
So that is very scary. And, if we look at the way healthcare access is in our country for citizens,
Yeah.
what do we think it's going to be like for detainees?
Mm.
Whether they're citizens or not, they ended up there because somebody isn't thinking that they should be in this country. So,
Mm-hmm.
what did we think it was going to be better? Absolutely not. We can't even get our own stuff together, right? Like, let
That's right.
alone take care of a population that we think shouldn't be here in the first place. So, and by we, I'm not including us, obviously.
Sure.
So
The powers that be.
the powers that be. So
Mm-hmm.
this stuff, it's not rocket science. This is scary. And this is exactly how the science plays out. And we're seeing it in real life. Now, you can draw your own parallels as you have. I'm just speaking from the physician perspective.
Absolutely. If you're just joining us, I'm Natalie Bencivenga, and I'm with physician Dr. Natalie Gentile, and we're breaking down sort of the hellscape that is our healthcare news of the week. If you have any thoughts or questions, please feel free to put them in the comments below. And as always, keep it respectful and feel free to subscribe to both of us at the top. Okay. So in the vein of continuing to debunk healthcare myths, I wanted to talk a little bit about the whiplash that we are experiencing, because to your point, part of the confusion and the chaos, which we know is intentional, does exactly this. We put stuff out there and then we take it back. And then we put stuff out there and then we take it back. But sometimes it gets taken back because of public outcry, which I think is an important point, because none of this is set in stone. We can choose to reverse course at any point. We can choose to have faith in our institutions if they behave in the appropriate way at any point. So all of this is choice. And last week, the U.S. Food and Drug Administration abruptly reversed course, because I was in the middle of writing about this, and then they changed it, and I had to delete the whole thing and start all over again, because this is how fast things are moving. Reversed course on Moderna's first of its kind mRNA-based flu vaccine, agreeing to review the application after initially refusing to consider it. Now, this is a rare regulatory move that has reignited debates over vaccine science, policy, and public health leadership. The decision could determine whether a next generation flu shot arrives in time. We've never experienced this idea that will we have one for the next year's season, 26-27 season, after industry and public health voices criticized the FDA's initial refusal. Before we get into this, Dr. G, I also want to make a note that I just read an article, and it's not for today's topic, but it's an interesting dovetail, that there were a lot of concerns around the COVID-19 vaccine because it came from like this mRNA technology. And there were some people that did have adverse reactions to it, blood clots, et cetera. Well, I read this study that said they have found out why that happened. And they're now in a next generation. They're like, this won't happen again. And so I just wanted to put that out there, because I want people to understand that we acknowledge vaccine injury. We acknowledge that nothing is foolproof. But what is so cool and important to know about science is when you learn better, you do better. You gather information, you gather research, and then you make the next iteration of it better, more effective, stronger. And that's what science is. And so
that's called the scientific method.
That's called the scientific method.
Yeah.
And so I say all of that to remind people that what you do, for example, you call it a practice for a reason. You practice medicine because you're always finding ways to improve upon what you've done. And so I think a lot of this mistrust, distrust is in this idea of the inflexibility of perfection, right? Whereas science is allowed to say, yeah, there were issues with XYZ, but we figured it out and there won't be those issues, or there'll be way less, there will be way less issues. So I just wanted to make that note, because I found that exciting that these vaccines are even going to be better and safer for the next round. But when we're looking at this Moderna mRNA flu vaccine, can you talk a little bit about, once again, what exactly we're dealing with here when you're hearing, no, this isn't happening. Yes, this is happening. Will we have a flu vaccine? And then do you think this really came down to, did somebody get a phone call and say, hey, y'all are trampling on $1 billion trillion industry. You better back up. Like, I'm just wondering what your thoughts are.
First of all, always follow the money. So, there had to be something along those lines.
Preach.
I will say this past flu COVID season beginning was an absolute show.
Yeah.
Can I believe myself?
I mean, there's
it was a mess.
No other words for it.
August thinking, like, telling my patient that I don't know what we're going to have. Like, I don't know if we're going to have the flu shot. I don't know if it's going to actually be good or not. I don't know if we'll have a COVID vaccine. We were left in the dark, and it's February right now, and they're questioning right now, what's it going to look like for this season? I mean, that does not bode well.
No.
I will say this excites me, knowing this technology and how effective it is, that we could have that option for a flu shot, because historically the flu shot is not always as good as we want it to be each season.
That's right.
Right? And so if we have something that could potentially be better, more effective, more reliable, God, that would be absolutely wonderful, right? Because, it's good enough what we have right now, but if it could be better, that would be fantastic as a family doc to hear that.
Absolutely. When you've experienced the flu seasons with your patients, I never used to get a flu shot. I never did. And then a few years ago, I think when I started seeing you, you were like, hey, have you ever gotten a flu shot? And I was like, no. And you were like, yeah, you should. And I was like, okay. I started getting, because guys, I do listen. Don't my husband.
She listens
I do listen to Dr. Gita.
And that's all I can say.
Exactly. That's all we can speak to. But, I do find it interesting now that I've learned a lot more myself just about the psychology around vaccinations. And I think sort of this sense that, as a younger person, you don't really think about the flu. You're like, oh, that's not something that bothers most people. But then you start to understand, oh, wow, a lot of people do die from the flu. A lot of people do get really sick. I don't want to get the flu and possibly give it to somebody that could end up in the hospital. So sure, I'll get the flu vaccine. Have you found people to be more or less receptive around the vaccine idea in the last several years, in particular, since all of this chaos is happening? Like, is there this sort of sense of, well, if the CDC is saying this, and now I don't trust the CDC, I'm definitely going to get the flu shot, or I'm definitely going to listen to my doctor? Or do you think it's just getting worse?
It depends on who your patient population is. So I think my patients choose to become my patient, because that's how this practice model works that I have. My patients tend to be very well educated around this, and frankly, they're seeing the writing on the wall. And so a lot of them, over the past couple of year or so, have just been scared. I want to get access to vaccines while I can. If you go on social media though, and that's who you're talking to, I mean, all my algorithm makes it seem like is nobody believes in vaccines. So it's really hard to get a gauge, right? I don't have a finger on pulse on the entire world, but what we do know is that when there are surveys done, we're seeing reducing first of all, uptake of vaccinations across the board, to the point where now we are not at a herd immunity level in many places for things like measles, and also vaccine trust going down. So, I think the confusion is clearly working because it's causing more confusion. And what does confusion cause? Doubt. And for me, all it took, because I was like, whatever on the flu shot, my high risk patients, yes, absolutely. But for me, whatever. When I would talk to my Palm Critical Care best friend, who takes care of people my age dying, completely healthy, dying in the ICU from the flu, that was what did it for me.
Yeah.
No, I'm good. I don't want to mess with that.
No, I mean, now it's when that time of year comes around, assuming we'll still have access to the COVID vaccine, I mean, I just tell you, just give them to me now. Just both at once, let's just do it because I'm here, kind of a thing. So yeah, I think it just puts in perspective your own mortality and your desire to live to fight another day. Yeah. Speaking of mortality,
puking in your mouth,
I wanted to wrap this show up today, you guys, with something a little fun. And by fun, I'm like, oh my God, what's happening?
Oh,
I saw this video when it came out a couple of days ago, and I literally burst out laughing. I think we sent it to each other at the same time. Like, we've been just joking about this in our group text. Kid Rock, did everybody else see this? Okay, Kid Rock and RFK Jr., they decided to team up. They're teaming up to tell everybody to start working out. And now they're focused in on ultra processed poison, calling on Americans, this is my favorite part, to put politics aside for their health. They've been doing, I love this. This is I wish I had, someday I'll have a better thing. This is on Fox News. It's called Mayha Mania. It's Kid Rock and RFK Jr. together doing a segment.
what?
Yes, it's beautiful. And they said the video that they did says it's gone viral. It was a fitness video inside a sauna. They were doing like push-ups and stuff, which was so bizarre. They said it was just meant to encourage Americans to adopt healthier habits. And I just want to understand exactly.
We don't have enough time for that, Natalie.
We don't have enough time, but, and I know we're short on time, but it's just, I want to understand like the thought process here, and also like why. And also, do you know, when you saw this, living in these healthcare spaces as you do, what was your first visceral reaction to this Kid Rock RFK viral moment?
Like, I'm not kidding when I say I puked in my mouth. And then when I got past that, I started to think of like, how much ringworm did RFK Jr. pick up and whatever that sauna was that that Kid Rock owns, and or wherever they were. And then my next thought was like, Kid Rock is not the person I think of when I'm like, health.
No.
Right? So that was real confusing to me. And it's also interesting coming from you, like, as somebody who loves to talk about like body neutrality and weight inclusive care and seeing just the atrocities of the things that have come out in the past year from this administration around body shape and fat shaming. I also want to talk about the juxtaposition of seeing RFK Jr.'s body, which is like rock solid, like rock freaking solid. And then Kid Rock, who has very little muscle appearance. And honestly, like, as a physician, I look at it and it reminds me a lot of a liver disease patient, like and which it makes me sad.
Yeah,
you know,
course.
and I look at these kind of like, what an image. Like, where are we? Who thought that who was the creative designer behind all of this? Right. I'm confused. I'm not sure where the messaging is supposed to be going. Well, but the reason it went viral is because everyone's laughing at it.
Well, and here, to your point, I'll answer that question for you, how these two teamed up, because they apparently met about 10 years ago, said Kennedy. And he said that recently Kid Rock made the decision to change his famously dissolute lifestyle and start eating good food and exercising and maybe live a couple of years longer.
Okay, so it's a project.
It's a project. Okay. And he invited me down to see his training regimen. So this is sort of the backstory. Yeah, I know. It's just it's a bromance.
Sad. But it also makes me just sad. I'm like, oh, this is so pathetic. It's yet another like revenge body. You know, like it's another.
Yeah. I know.
So boring.
I know.
They're also boring.
They're also boring, and it's also just like, what bothered me about all of this was this idea that we're gonna tackle this epidemic because 70% of the food that we eat is ultra processed. This is coming from him, calling many products on the store shelves food-like substances. But what they're not going to address in any of this is access to clean air and clean water. That's going to create a good soil, good air for good quality produce. They're not going to talk about food apartheid in this country, right? The sort of food desert concept, but it's an intentional one. They're not going to touch on the fact that we don't have universal healthcare. We don't have access to physician care. We're trapped in these cycles of medical debt. They're not going to talk about the fact that we don't have access to lifestyle medicine in the ways that you really bring into the community, Dr. G, that community-based care. We don't have health insurance. Like, there are so many things. Our kids, the food that we serve to our children is equivalent to what they serve in incarcerated spaces. Everybody's quality of food is too poor. Yeah. So there's this sort of easy way of saying, oh, eat better, feel better. but we're not going to do any of that. I mean, Trump just said he wants to expand I can't think of it's called glycosolate.
Glycophosphate.
Yeah, it's found in Roundup. They're basically removing all the barriers on it so that they can start using it more for production. Well, what? Like, so you hear they're limiting or removing access to vaccines. There's no maternal, like you can go on and on, right? So it's just one thing that annoys me about this is just the lip service around it.
Oh, I mean, who finds it relatable to see them working out in a sauna with full workout equipment?
Right.
Like, again, it's just tone deaf, and that's the usual. Yeah. And it's bizarre. It's truly bizarro land. That, the Mike Tyson ad, all of it is very like, sometimes I feel like I'm like not all here. Was I hallucinating it? But unfortunately not.
No.
It really happened.
It really happened.
And now I can't unsee Kid Rock without a shirt on.
Oh, the image I never needed.
Yeah.
Oh my goodness. Hello. Well, on that note, I think we're just going to wrap this little
party up. Sweet dreams, everybody.
So, yeah, enjoy the rest of your day. We know how to bring out the sunshine over here. But Dr. G, if people want to connect with you or learn more about your work, you're super active on social media. You've got a bunch of great clips on short workouts you can do on YouTube. Where can people go?
Yeah, I'm very active on social media at Natalie Gentile MD on Substack, on YouTube, on Instagram, and on Threads, which is a funny space.
I've been enjoying you on Threads. Oh, everybody, thank you so much for tuning in for another edition of sort of the healthcare notes to know. We'll be back regularly as always. And until next time, please take care of yourselves and each other. All right, have a good one, everybody. Thanks, Dr. G.
Thanks.